This is my first contemporary forums. So far I've enjoyed it well. I chose it because a friend recommended it that has attended 2 or 3, I think, of the forums before. She convinced me due to the fact that we can be in one spot and get a whole lot of continuing education units, and she really enjoyed the folks that were the educators in the program. She had known them prior from the other forums, and it's been very nice. The last couple of days I've been here, we've learned a whole lot. It's a whole lot of information at one time, but I've took a lot of notes, and I'll certainly be using it, and certainly would return to contemporary forum. Of course, with pharmacology, you can always learn something because it changes every day, just about. So some of the new things that they've brought out that's just really new that's come out. Some of the things that probably I've forgotten because I don't deal with that maybe. I actually am a nurse practitioner and I work for United Health Group, Optum Clinical Services. Most of my patient population is geriatrics. So a lot of what they talked about though does pertain to my patients. For the past 2 days, a whole lot of what they've talked about pertains to my patients. So there'll be lots of new things or changes that I'll be looking at and can take back and discuss with the other several thousand nurse practitioners that work for us. Well, C. diff that we just finished up here this evening, that again, and some of the new medications that can be used, certain antibiotics that they don't recommend nowadays, you know, like the fluoroquinolones and certain ones of that. I mean, certainly I'll be looking at those things. Also statins and certain other over-the-counter medications that we should not maybe be using, or patients should not be using with the statins. We try to look at that a little more closely as to what the patients are taking at home. They don't always tell you, so sometimes you kind of have to prompt them, you know, are you taking St. John's wort, or are you taking, you know, something else like that? Fish oil, how much fish oil are you taking, you know, whether it's even useful or not. Aspirin, every patient is on aspirin just about, so, you know, that's not recommended now, but there'll be certainly things that I'll be looking at and possibly discussing with their primary care physicians, you know, about certain things. So, yeah, Alan and Jody are wonderful. They have done great presentations, and like I say, I like the humor that they use and how they present, specifically with giving certain examples of even patients or personal indications. So yeah, Jody and Alan have done a great job.